According to the Childhood Cancer Organization, nearly 16,000 children will be diagnosed with cancer. WVUA 23's Taylor Mooney has more on how this deadly disease impacts families and what a researcher is doing to help. Taylor?
Battling cancer is tough for adults, but parents say it's even more difficult when your child is diagnosed. Dr. Sherwood Burns-Nader, an assistant professor at the University of Alabama, is conducting a study on parents whose children have recently been diagnosed with cancer. Dr. Burns-Nader says she's passionate about the study and hopes to help parents find ways to cope with their child having cancer.
As I've started and contacting places to let them know about the study and getting to hear from families, it's really made it even more powerful and more passionate about it.
Right now, 10 families are participating, but as many as 60 could become part of the study. Dr. Burns-Nader says it's important to make sure parents and family members are coping in the right ways because it affects the patients as well.
Children tend to pick up on that, and so they become more anxious, and they read their signs that their parents are giving them, and they display similar behaviors. And so we want parents to be coping as well as they can be to help children cope. And I think this study is going to give us more information about their experiences so we can know better resources to help make that happen.
The Watkins family knows the feeling all too well. Their daughter Reagan was diagnosed with acute myeloid leukemia at just 22 months old. Reagan is now 5 years old and in remission, but it's something the family remembers every day.
We didn't know from one minute to the next if we would have a child that we would one day be able to hold. When she was on those machines, you could touch her toes. You couldn't hold her hand. There were too many needles and too many lines to do any of that, and we're not the only parents that have been through that.
Reagan was at Children's Hospital in Birmingham for nearly a year, spending 30 straight days in the intensive care unit. Erica Watkins offered one last piece of advice to parents who received the horrible news.
Don't give up hope. Don't give up hope, and as a parent, you're your child's best advocate.
If you would like to get involved in the study, you can contact Dr. Burns-Nader at parentstudy.ua@gmail.com. Reporting live, Taylor Mooney, WVUA 23 News.